So, hello everyone. Good evening. Welcome to this session. I hope you are all relaxed now after the INI CET. And with me is Dr. Ramya, your faculty of OBG. Hi, Dr. Ramya.
Hi, ma'am. Hello, students. How are you all? Right. I think that, this is more than the relaxing time. I think you should get boosted up for the next NEET, the most
Yes,
important.
bigger goal is
Yeah.
there in front now. So, how was your subject, Dr. Ramya? What is your feedback after INI CET paper?
So I think, ma'am, in our subject in Afghan, actually before this year, the entire paper was of Afghan, but this year in the INECET is fair enough. They have given an adequate number of questions, and most were the previous year questions. So I think it's very, very important that they should be perfect with the last 5 years of INECET as well as NEET PG question papers. They definitely hold. And apart from that, many clinical questions which we usually discuss through our classes were also definitely present in the session. And we have observed that usually if they are perfect with the notes, that's more than enough.
Yeah.
So what about your subject, ma'am? Like how was Oftal for the exam session?
Yeah, so same with the Oftal. Actually, for the INI CET, Oftal is always a typical one. Like AIMS people are always known for asking very typical questions in Oftal. And that's why, I have a greater burden on me that what will they ask? But luckily, they haven't asked anything that was out of the syllabus, out of the course. And Ofthel was good enough. It was a piece of cake. Many students said that for the first time, Ofthel, we could do everything. And everything was covered from the notes. Some of the questions came directly from the PYQs, directly from the notes also. So students were quite happy. And as you said, PYQs and the PYQ topics are definitely one thing that should be actually focused in the last of the months. Like, that dilemma has gone now from the minds of the students that whether I should prepare for INI CET or ma'am, I should sit directly for the NEET, whether I should focus on these topics or those topics. So now you have one major paper na, and I think uske baad you have got one very good feedback and your strength weakness analysis. You get to know where you are weak, which subjects, which topics, and now you can work on your strength weakness analysis. Right?
Hello, Vivek. Hello, Vivek. Hello, Shatabdi. Hearty congratulations, Shatabdi. Well done. And I definitely
Shatabdi
know.
has also jumped from a very big rank to a
I remember Shatabdi from her when she used to come for the Kolkata classes. She was definitely very active and, very focused, and that definitely helped her. I think that's awesome, Shatabdi.
Oh, yeah. Sai said that I watch your classes for FMG. Hello, everyone. I hope you people are fine. And yeah, one thing more. This session we are also going to take the question and answer. So if you have any queries, any doubts you want to ask, or from Dr. Ramya, you are welcome. You can share your questions in the chat box, and meanwhile we will take the questions also if you have any. All right. So yeah, she's saying my two favorite teachers. Yes, Dr. Ramya is also very, very popular.
Thank you.
Yeah. So yeah, I know that most of the students, like many students, have done very well from the DPMCI, and we have been taking interviews since yesterday. Heartiest congratulations to all those students. But yes, we are also concerned for those students who could not do very well this time. But don't lose focus. Don't be disheartened, because in these interviews also you have seen that people have jumped up from 90,000 to very, very amazing rank, or 1 lakh or 80,000. So I think that is a great motivator, that if you have a right strategy, right mentorship, and of course your right focus, then you can do wonders in these 100.
Actually, to be frank, this is the time where we are very fragile. So, we are like little pulled back with our results, like some not satisfying, or, a question mark result. Because from yesterday, I've been getting queries from the students like, will I get this seat for this rank and all? Instead of thinking any of those things right now, it's more better. Probably you might get what you're dreaming for, or probably you might not get. But right now, what is most important is continue your preparation for the NEET. Don't stop here. So don't stop here, because you have one more goal to hit. And if this time it is like you have done the practice, you have understood the atmosphere of the exam, you have understood like what might be the questions which they can ask, and how do I approach, and you have to analyze yourself, which subjects I'm weak. What was I doing silly mistakes, or was I doing conceptual mistakes? This is the time to analyze and pull yourself on the track, more than getting here and there. I know it takes very good P. That's very good.
Yeah. So I think the best thing is that without thinking much, you start studying. Take your focus, because, many times we actually waste time thinking what should we do, thinking what should we read first. So start reading, start all over again. And suddenly you will feel that you are back in the track. And you will lose that stigma that I haven't done well. Because when you don't start reading now, you have that much of time that you are thinking about this and that. But when you go again into the race and get into that track that you are reading again, then you will forget all those things, and you have a bigger goal, that just the bird's eye. You have to look at the bird's eye. Yes. So yes, all those who have recently joined, please keep on asking your questions and give your doubts, so that we and like me and Dr. Ramya can answer them. All right. So as we were discussing also, that many of the questions came from the PYQs and the PYQ topics. And even if you are starting now, and even if you have not you were not able to give your best attempt, you feel somehow that this was not my best shot, and you want to give your best shot in the NEET PG 2023, you have got good 100 days. And if you have a good strategy, good plan, and you focus on the higher topics, you will definitely be able to do well. And this INI CT has proved that the conceptual teaching that we are doing, all the faculties at DBMCI, is always helpful. What do you say, Dr. Ramya?
Yes. So I definitely feel like, whatever we teach you in your classrooms, that's more than enough. And you have also observed that those are the possible questions which are coming. As well, after every topic, we do some MCQs, and we are putting a lot of clinical MCQs. And like in the very same exam, that hypertension MCQ, which we all do that in the class. We have done it in our class. So, same questions are again coming in your exam. So practice the notes, and along with that, do the MCQs. And I always tell, like, daily night, post dinner, try to always keep learning either PYQs or the clinical based MCQs. That is the best time where it is more better to do something like which is giving you more push, right? So keep continuing the studying. That is most important.
Yes, definitely. Like some of the questions were as if they were opening our notes only. Like I always start the OFTA from the visual acuity, and like they also started with that 6x60 with Snellen's chart question. And some of them said that yes, we felt that as if the DBMCI teachers have made the paper, because most of the faculties are actually discussing the clinical scenarios. They are telling the approach, how to deal with those clinical questions. And obviously life becomes easy when you know how to approach those questions. You already know that these are high topics, these are the PYQs, and obviously then you do the MCQ practice, right? Yeah.
So, Niharika, I think you put a query that around what rank we should expect that we are on the right path. I definitely don't think you're required to judge yourself by the rank which you got in the INECET, whether it's a positive or a negative rank. You can, this next 100 days are more than enough for you to get a very, like, a drastic change in the rank if you properly strategize this next 3 months or this next 100 days. And definitely we are always there to help you for that, but these 100 days play a very crucial role for you to define the rank which you can get in the NEET PG. So don't worry, like what is, there's no judgmental, like what is the rank, should we expect that we are in the right path. That's what I feel. Ma'am, what do you say on that?
Yeah, exactly. Like many people feel that, we are getting low GT scores. So they even stop giving the GTs because they are demotivated by the low scores. But always take these scores as a learning tool. Avoid them taking them as a testing tool because, whenever we do the MCQs, we learn a lot. Many things we learn even from doing the MCQs. And I think you must be happy whatever mistakes you did in INICT, you at least came to know. Now, these mistakes you can work upon, and obviously you will never repeat these mistakes in NEET. So give your GTs as if you are giving the main exam, so that you can give the main exam as if it is just a mock or just a GT. And that is what I was saying, that many of these stories are so motivational, and deliberately I asked them to tell that what was their previous score, so that you are not only allured by their recent rank, see how much they have jumped from their previous rank. So if they can do it, definitely you can also do it. It is just the focus and the right mentorship with the right strategy. So if you are ready to attribute those 100 days with at least 10 hours study per day, we can give you a guarantee and a promise of a good score, which you will say that, yes, I have given my best shot. So
I do think, ma'am, like, instead of in every GT, instead of like, seeing what is your rank or what is your score, you have to start competing with yourself. Don't compete with others.
yes.
You should be in a race with yourself. Every GT, compete with yourself. So probably in this GT, let us take the lowest mark, like you've got 500. Don't worry. If you have got 500 in this GT, your next target should be that I should get 5, 525. Next, 550. By the time you go to your exam, you will reach that 700 to 800. So start competing with yourself. Try to be a better person every day in your whatever the program or whatever the schedule which you have done. Like today you are supposed to finish 90% of OpGuide, but you could do only 50%. No worries. Not giving up is most important. So tomorrow you pick it up to 80%. Slow and steady definitely wins, but you should not stop. I think that's what we have been learning from so many days, and that definitely helps. Yes, we are going to give you the schedule for the next 90 days. How many times we should revise the syllabus? Again, actually, your first revision should be taking longer time. Do it perfectly. After that, to be frank, my subject ObGyn, if you have done the proper revision first time, hardly 1 day for Obs, 1 day for Gynec. It gets over. And in revision, you're not going to go again everything from the baby. Like you're not going to study everything. It should be the key points, right? So I think minimum 3 to 4 revisions are must, no ma'am?
Yes, exactly. So that's what I always tell you in the classes also, that your revision should be in the pyramid way. Every time you will not get the same number of days, and every time you will not go from A to Z. And that is one reason I always insist my students to use the highlighters and colors in the notes. Some of the, faculty say ki ma'am to bahut sare colors use karti hai. But the thing is that, when you are revising the things and if you have highlighted the important points, you don't have to read the whole story to revise. You just read those important things and you will go away. So it's very important that you just see the highlighted things. And if you have done that, after the one main revision, you can easily do at least 3 revisions. And that is what I have confirmed from so many of the rankers also. After the main reading, if you are able to do 3 good revisions, then that is more than sufficient. See, one size will not fit for all, and One
Yes.
plus minus will do, because some people are slow learners. They will take more time in the first revision, and maybe they will be able to do only 2 revisions. That's not a problem, perfectly fine. If you are a fast learner and if you are completing it before, then you can give one more revision. Instead of 3, you can go with the 4 also. So plus minus can always be going. Yes, yes, highlighters helped a lot. Oh, thank you. All right. So I think, Dr. Ramya, we can share the strategy, because many people are asking about the schedule for the next 90 days, right? So
Yes, ma'am.
I would say that if you have your own plan and if you feel that you are able to do it, then it's not a problem. Stick to that. But if you are not able to make a plan, or you are not able to stick to that, you are not sure about it, then definitely we also have a plan for you, and you can go through that. So let me share the screen. And yeah, uh, is my screen visible?
Yes, ma'am.
All right. So yes, guys, so we have a good plan for you for the next 100 days. And in these next 100 days, we have divided this in such a way that you are able to complete your 19 subjects with the first revision in the first 50 days, right? So when you are able to do it in the first 50 days, we will have the time for doing the GTs also, and then multiple revisions. So how to divide these 50 days? If you see, we have given the basic sciences like anatomy 4 days, biochemistry 3 days, physiology 2 days, path 4 days, pharma 3 days, micro 3 days, and the smaller one like we have forensic 1 day. Now I is 2 days, ENT 2 days, PSM 4 days, medicine, surgery, and obs gynae, as Dr. Rama is also saying, na, if you have done 5 days before, I think, Dr. Rama, we are able to revise it for 2 days then. 1 day obs and 1 day gynae, we can do the revision then.
Yes. The first revision takes little longer time, but after that, it gradually decreases.
Right. So we have given 2 days for the pediatrics, then 1 day ortho, 1 day derma, 1 day psychiatry, 1 day anesthesia, 1 day radio, and total this will make 50 days. Now, again, there is a disclaimer that if you feel that you require 1 more day for any of the subject, and you are comfortable with decreasing any of the day with the other subject, you can very well do so, because you may have read any subject before and you may be confident in in one of the subjects, then 1 day plus minus you can do it. But on the whole, having talked to all the faculties, we have made this plan, and I think this will work for most of the students, like anatomy 4 days, and that's all. Okay, so if you
So
see,
basically, the first 50 days, we are finishing out the first revision. That's like very positive for them.
yes, yes. So if you have done this revision after 50 days and you have still 50 days left, you have still 50 days left now, so that will give you a good boost. Oh, we have read our all the subjects, and that too not in hurry, Dr. Ramya. We have given a fair enough amount of time for all the subjects. Like 13th November ko we had already completed the INI CET, and now we have started from 15th November, having thought that we are not wasting any time. Okay, so we have started from 15th of November, then 2 days ENT we have done, then we have done the anatomy, surgery. Now we have kept it in such a way, because anatomy and surgery obviously are related. You will have to go through the anatomy before you do the surgery, so it's always better that you read the interrelated subjects. After surgery, if you want, you can correlate it with the radio, something like this. With the medicine, you can read with the derma, patho, and pharma, so that will help you in collaborating and doing the study in the integrated way. And then in the meanwhile, you have to start giving the grant test also. What do you say, Dr. Ramya? Should we wait,
Yes.
or should we start?
No, definitely grant test is very important. I think I always tell this, like, most of the time we focus only on the revision, and
Yeah.
we we don't try to solve the GTs, or we don't try to solve the MCQs. But I personally feel like 50%, see, you have learned one topic, but you should know how to apply it back on a clinical MCQ, which most of the time we lack. What we do, we learn it. Abruption is this, abruption is that. Okay, finish. But when we are trying to apply that back in a clinical scenario and a clinical question, we miss it. Especially the clinical subjects are more about the management with the patient's age and all. So definitely start GTs and never miss any GTs. That's very, very important. And keep
Right.
solving MCQs also.
Yes. And as we keep on telling you in the classes also, that please prepare one extra notebook. What is your 20th notebook? And keep it for your GT analysis. See, it is more important to review your GT, to do the analysis of GT rather than giving the GT itself. So if you are giving the test and if you are not reviewing it, you are not able to see what are your strengths, what are your weaknesses. That will not be as beneficial. So keep on preparing a notebook. And as I always tell you in the class also, write down the date, write down the GT, and write down the score, what you have got there, and write your mistakes, whatever was volatile for you, whatever you got it wrong there, so that at the end you have a notebook full of your mistakes. This is what will help you in the last, what you are going to read in the last, because you know, the largest dilemma is what to read in the last 15 days.
I 100% agree with you, ma'am. And really, to be frank, this I have done during my preparation, and it definitely works for everyone. So, we all should have that one book which we want to revise in the last 7 days or the last 15 days, because last 7 days you can't do anything. And instead of having that panic attacks and all, we should be knowing now itself ki last 7 days what I do. And revising your mistakes in the last 7 days is the best idea you can have. And apart from that, in that book, you should have all the important tables, like from OBGYN, your cancer staging, cancer management, all the important tables, whatever you want to do, like every subject, you read something, you feel this I might forget. Write in that book so that last 7 days you will go through it. So do that book without fail. It definitely increases or helps you to pull up your rank. And yes, I think we can do a special shout. We can also, Sarthak, I think it's fine. I know you can still get a better rank if you work properly in this next 100 days. That's what we are trying to help you. But just try to analyze, where did you go wrong? What are you lacking in your preparation?
Sometimes you do not know that how much close you are to the diamonds and you are just going back. So don't go back, Sarthak. Maybe you are very close to your diamond. Keep on digging and definitely you will get success. Right. So yes, so we are having the 4 days for patho, and as Dr. Praveen also told, that 4 days are more than enough. We can do good revision, and 5 days will be enough for OBG, Dr. Ramya.
I think if they're following the notes, 4 days are more than enough. So one day will be like a grace where they can do a lot of MCQs.
Lot of MCQs. All right. Okay. So one day for radio and then pharma. So on 13th of December, we are ready for our second grand test. I think we have given a good amount of time between the two tests also. Meanwhile, you are completing more of the subjects, and as you complete more and more subjects, obviously more and more MCQs will be getting solved and you will get more of the integrated study. So by the time you come to the second grand test, I think your score will definitely improve, and obviously your motivational level will also be very, very high. So somebody is asking for NEET PG, from which year onwards we should be solving the PYQs. Any inputs, Dr. Ramya?
I think last 5 years are more than 5 years will be adequate.
No, they are saying from which year we should start solving the I think he's asking from third year or from his prof, that from which year he should start solving the PYQs.
Okay, yeah. Yes, ma'am. Yes, ma'am.
Maybe he's asking this, yeah?
Yes. I think always better to start from third year, no? Nowadays, and
third year is a pretty subjects when you will start.
And Vivek, cancer staging, I have personally done some mnemonics for cancer staging. I do know that students face it very difficult. In the YouTube of Bhatia itself, you can search it. I've done one staging one mnemonic for cervical cancer staging and one mnemonic for ovarian cancer staging also. So you can definitely go through it. It will definitely help you to remember the closest possible.
Yes, so you can look at the video and you can make a small note down over the sticky pen, and please stick on the some wall, so that whenever you pass by having a cup of tea or coffee, you are always looking at this. This will form the visual memory, and that visual memory always lasts
That's
longer.
stronger.
So whenever you take a cup of coffee or tea, always start looking at that. And that is my way also. Whenever I used to feel that something is volatile for me, or I'm not able to remember, there were so many sticky notes in my room, and I think that will make better for you also. No, ma'am, I am asking 2018 onwards or before that. Okay, you are asking this. So as we both are telling, last 5-year questions. I think there is no point in going 5 years back, because the pattern of the questions and everything is very, very different before 5 years. So if you are doing 5-year questions, that is more than enough. And whenever you are doing the PYQs, you have to do the PYQs of both NEET as well as INI-CT for both. Even if you are giving INI-CT, you have to do the NEET PYQs also, and vice versa. If you are doing the PYQs for the NEET, do from INI-CT also. All right.
And most of the time it is, more than the same question dropping, it is the same topic. As in when you're solving like, first paper, second paper, you get to understand ki, oh, these are the topics which I have to concentrate more. Yes. This is the potential topic. And in that topic, don't leave anything. You should be perfect with the topic. So, the topics keep repeating, then the same questions actually.
Yes. Ma'am, should we more focus on PYQs or on the question banks? So, Anu, I think we have answered this. PYQs is something that you cannot leave, and practices of MCQ is required. So after completing the PYQs, you have to see how many MCQs you can do. You have to at least put in 30%, like 70% theory and 30% of the time in MCQs. More the MCQs you do, more you feel confident and more you learn the art of doing MCQs. MCQs are not just the academic theory. It is also the skill. You learn this skill. The diagnosis of exclusion that I told you in the previous videos also, that you have to learn this. Even if you do not know the answer of any question, you can reach to the right answer by doing the diagnosis of exclusion. So this you learn from practice of doing more and more MCQ. So obviously,
so I think we have a query from Neha. Neha, I think 100% agar if you're going to do this next 3 months, like, a proper organized without any, like a penance, tapasya. Yes. If you're going to give your 100% the next 3 months, definitely you'll get a good rank. Nobody can stop you from getting a good rank. Be perfect with your notes. Do 5 years PYQs, solve some MCQs, give nice GTs. That's over. That will aram se land you up in the best rank. Okay. So be confident. Try to give this 3 months your 100%.
Yes, exactly. So by the time we are completing this, from up till 29 December, we are able to give the GT3. And then we have to go for the medicine 5 days, physiology 2 days, forensic 1 day, and still you have got 2 catch-up days. Now, these 2 catch-up days are entirely yours. You want to revise any particular subject, you are messed with any particular subject, because, all 50 days are not alike. Obviously, someday you may be feeling low, you may be demotivated, you may be not feeling well or anything. So if you have these 2 extra days, you will not be messed up. Now, one thing more, what if I am not able to do the medicine in these days? Okay, so one very important question is that should I go to physiology next day, or should I continue with the medicine? So please don't continue with the medicine at that time. Follow this rule, because in the last you have got 2 catch-up days. So don't perturb your plan at that time. Keep 1 day extra in the last and you can catch up at that time. Okay. So there is one more question, Dr. Ramya. How should I go about solving the question bank? Should should I
I
bother with the
think
entire feedback?
now finishing the entire question bank is something which is little difficult. So
Yes.
you can do most important topics in each subject. Like choose the most important. We all give you the list of the important topics. No, at least important topics may do try to solve the all the MCQs.
Yes.
Then going through everything, but be perfect with the past 5 years PYQs and subject wise custom modules.
Subject wise custom modules or custom modules of questions that incorrect GTs. I think he wants to ask that whether we should do all the subject wise or only the incorrect questions. If I am right, Sarthak, you have to be thoda sa specific. My GT score not improving, so I'm afraid of giving the GT and left. So that is what Dr. Ramya also told, and I was also telling you that don't worry about the GT score. This is not the final score. It is just a learning tool. Learn from yourself, and your biggest competitor is you yourself. So try to improve yourself from your previous score, and definitely as you go on improving, as you proceed towards the further GTs, your rank and your score and your confidence will definitely improve.
And Satyam, I have personally done one video on the Bhatia YouTube channel. You can search it, how to improve the GT score,
Yes.
where I mainly spoke about 4 problems we have while doing the GTs. So I want you to just go through. It's a hardly 10 minutes video. So you can categorize ki where is your mistake? Like what am I specifically lacking? So that you can correct that. And most important, we have been speaking on this, ki it doesn't matter you're getting good score or you're not getting good score. Not giving up is most important, not
Yes.
only for any of these aspects. Baby steps are still fine, but continuing the steps is most important. So matlab कितना भी बुरा है छोड़ना मत, कंटिन्यू करते जाओ. That's most important.
Exactly. भागते रहो, भाग नहीं पा रहे तो चलते रहो, चल नहीं पा रहे हो तो रेंगते रहो. But you have to crawl even if you are not able to. Don't stand anywhere. Very, very important. Exactly. All right. So till 8th of January, now this is very, very important. Till 8th of the January, you have to complete the entire course, and then it comes the time for your GT4. And uske baad, I think Dr. Ramya, we have given a long time for the revision. So from the 10th of the January till 18th of January, again we are doing the revision, and this will be followed by another GT. So I think they should mark this thing that every GT should have lesser number of negatives, more number of positives, and this will give them more of the confidence also. What do you say, Dr. Ramya?
Yes, ma'am. Yes, ma'am. I think so. This is a beautiful schedule. You're almost having a proper 3 revisions, and
Yes.
for second revision definitely will take little lesser time. And
Yes.
one more personally, I have as a student, what I used to face is the first revision. Like Mano, I have kept anatomy 4 days. Somehow, first when we start anatomy 4 days, mein khatam nahi hua. That builds up the pressure ki, oh, I'm not able to do, I am lacking, and that disturbance lags up everything. So, and as ma'am already told, but I'm again specifying this, mano agar anatomy has not got over by the 4 days. So what can you do is jump to the next topic. And when you're doing the next topic and when you're pulling up the things, when you get a free day, then you do whatever the lagging portion is there. So, but follow the schedule. That's more important than lagging everything, every subject.
Yes, because why we are saying this? Because kya hota hai, Dr. Ramya, sometimes when you are stuck on one thing, that will keep on stucking you, and that even resist you to go to the other one also. So it's always better ki leave that thing. That is not the ultimate thing that will be coming in the exam. You can catch up later, but continue to flow along with the schedule. That is very, very important.
And I would like to add, the positive attitude of yours is the most important in the next 100 days. There'll be 1,000 questions popping up in our brain. Can I do it? Will I get a government college seat? Will I get my dream branch?
Self-doubt is always there.
Yes. So I think, as ma'am told, write in one big paper, like, what seat you want, which college you want, write it in a big paper and stick it somewhere, like, this is what I'm going to do in the next 100 days. And when you every day you see that, somewhere you start believing and you're telling the universe, and definitely when you are keeping on telling that to universe, it definitely comes back to
Comes
you.
back to you,
Yes,
yes.
there's one very famous, I always tell Shah Rukh Khan's quote. No, ma'am, can you tell it in a nice Hindi? किसी चीज को
हाँ, जब आप किसी चीज को शिद्दत से पाना चाहते हैं तो पूरी कायनात उसे आपको मिलाने से मिल लग जाती है, आपसे मिलाने से.
I 100% agree with that, and I always feel it happens. So, don't give negative thoughts कि
Oh,
मेरे से
how
नहीं
many Shah Rukh
होगा.
Khan fans here? Let's comment section में बताओ how many Shah Rukh Khan fans.
I think
Like
now,
I was a great fan of Shah Rukh Khan. मतलब
ma'am, now I think there is little drop down. I think there'll be more of Ranbir or yeah, Ranbir.
हाँ, हो सकता है, बट हमारे टाइम में तो इट वाज लाइक शाहरुख खान एंड ऑल गर्ल्स एंड शाहरुख
Yes.
खान फर्स्ट क्रश वही था. Okay.
Yeah. But next 90, 100 days, I think you should get only the dreams of gyne, of thal, pediatrics. You start getting dreams. I somehow tell, like, keep the book under the pillow also. Subconsciously you're reading.
हाँ, जा रहा है कहीं माइंड में जाएगा. ये बहुत सही था, पिल्लो के नीचे रखने वाला. पिल्लो के नीचे भी रखो भाई, माइंड में हो सकता है ट्रांसफर हो जाए और साइकेट्री वालों से पूछना
बस वो
कि ऐसा भी कुछ होता है क्या.
वो एक ही करके बाकी छोड़ेंगे तो मुश्किल हो जाएगी.
ये वाला सुन के ना वो कोर्स की किताबें ना रखे, पता चले कि शाहरुख खान की फोटो रख के सो रहे हैं, वो हो सकता है. ऑल राइट. तो अभी क्या है कि बहुत सारे लोगों को ये है कि दे विल दे बी एबल टू फॉलो दिस, क्योंकि many people are self motivated, they are disciplined and they can go along with this schedule, Dr. Ramya. लेकिन बहुत सारे लोग हैं which may not be able to make their own schedule and may
and
not
somehow,
be able to
always
follow
like
that.
when you have somebody holding you, I think it's always better.
It's always better.
Yeah, you get more motivated when you are in a group, or when you are having somebody to hold you.
And what if, Dr. Ramya, the best faculties from the Bhatia, all 19 subjects, and they are being given by the in a concise manner. Think if Dr. Thamim is teaching you all the important concepts and helping you in revising in just 2 days. Dr. Ashwini himself helping you revising the anatomy in just 2 days. And Dr. Rajat doing the radio in just 1 day, and I think you will be taking the OBG 2 days, right?
Yes, ma'am. So that will be a feast and easy for them.
Yeah. So for all those students who are disturbed by the fact that and you feel that you will not be able to do it by yourself, don't be perturbed, don't be disturbed. You are in the safe hands, and we are bringing some magical mega power course for you. And I think it's more than mega, it's magical. Its name should be magical power course. And let me turn down the curtains there, and you will be truly amazed to see that it's a great course where you are completing all the 19 subjects in just 27 days. Oh my God. So all those people who were asking ki, can we do now? What if I start now? And I think the recent INI-CET paper has showed that if you focus on the high yield topics, the PYQs, the PYQ topics, then obviously you are going to get a good score. And then these PYQs and these high yield topics are given by the legends themselves. Then I think beyond words. So see, we are coming with this mega power course. in many cities, many major cities across the country, and you can also join it on the DBMCI live app. You can join to the nearest city center, wherever is there, and you will be given a schedule, and we are promising that we are going to cover whole of the 19 subjects in such a beautiful consolidated manner that all the PYQs, all the high topics, all the images, all the concepts which we want that you should not be forgetting, you should be taking them in the examination hall, will be rendered to you in just 27 days. What do you say, Dr. Ramya?
That's awesome, and I think when they're learning along with us, I think it is easy for them to retain it. And
Yes.
it's always powerful when when we are, it's for them also and for us also, when we are looking at each other and learning through direct, it's always, it has a greater impact. And we always see many students like telling, I could hear your voice while I'm answering that
I'm
question.
answering the question.
Yeah, so that impact is possible with this.
So I am really, like, more than the, I think for the students, I am also really excited that how this course is going to be, because we have planned it, they have planned it in such a beautiful way that now I think no more confusions, no more dilemmas, and you will be definitely, this will help you in improving your score, maintaining the consistency, because consistency is the key to success. You have to keep moving. Speed can increase, decrease, but you don't have to stop. Yes. So so we have got these kind of schedules. At Delhi also we have Mumbai, and everything is planned. Like, we have made the best plan, best strategy, everything is ready. You don't have to now get into the dilemma what to study, how much to study, from where to study. You have to just come and you have to attend. And uske baad bhi, Dr. Ramya, this is not enough. After going from the classes, they have got the express videos, they have got the special revision test series. So it is not that we are there with them only in the classes. Even after going from the classes, they will be able to assess themselves with the help of their test series. They will be.
And I think if they don't have a center also, we have something exciting for them that we can, we are coming up through the DBMCA live app also showing all, having the entire schedule for them.
Yes. So all those who are not able to join there, we have got the live app also, and you can join it from anywhere. From anywhere you can join, and you can take the advantage of this beautiful magical course, I think. Yes. So there are certain questions. How to revise with TND and question bank. So Pratiksha, as I always say, TND is also a learning tool. Start doing the test, and whichever questions you are not able to attempt properly, go to their explanations. And after reading the explanation, if you think that you are not very well versed with this topic, then start noting down these topics and go to their respective subjects and read all those things. So at the end, you will have all those topics marked in the notes which you were not confident about, which you were not knowing that well, and then you can revise them in the last, right? What about next? Is it confirmed for 2023? So
that's a big question always.
So most probably, but again, we have to wait for some official confirmation. Yeah. I have a habit of solving PYQs again, but it doesn't fulfill my revision. I'm not reading my notes. These made my score stagnant. Okay, Shubham. So you have a good habit of solving the PYQs, but obviously you cannot do only the PYQs. So if you like PYQs, not a problem. Please note down the PYQ topics and read those topics also, because question as it is will not be repeated. It is the topics which are repeated. So if you are well versed with that particular topic, The PYQs are already done. Okay. And this is not a very good habit. If you are watching the videos again and again, I must say only those videos which you are not very confident in, only see those videos again and again,
I think
because
you should make the notes while you're watching the videos so that
yeah,
next
yeah.
time you just see the notes but not see the videos again and again.
Yeah, only those videos you can see if you are not very confident about a particular thing, so you want to revisit it again. But otherwise, you have to look only at the notes, not the videos again and again. Yes.
Ma'am,
So,
you can
yeah.
show them the centers, what all we have.
Yeah, so it is many centers. We have got at Delhi, we have got Mumbai, we have got Hyderabad,
Wonderful.
Bangalore. So you will get full information at our website. And for all those students who are not able to join at the centers, then they can join at the DBMCI live app also. So I think everything is ready. It is just like a bonus ready for you. All those people who are not able to make a schedule, who are not confident, and they want to give their best shot. So I'm again saying, give these days, these 27 days to us, and give your 100%. With the 10-hour study, definitely you are going to rock, and you are going to give your best shot, because the faculties have put in their whole hard work and their best experience in preparing this course. Because I think, Dr. Ramya, as faculties, we are also facing this challenge that we have to give the best and
Yes.
most high yield in those particular.
Yes. So
So
that they'll come back and tell like whatever we have learned from the class we have got the
yes,
same. And I think it's a beautifully planned, like all centers, the schedule is already ready, and that
yes.
shows how much everything is ready. That's wonderful actually.
Yes, so we are already, ready for the NEET 2023. So all those students who want to join, and who are not sure about their schedules, you are welcome. And even if you are at other platforms and you are already preparing from somewhere, not a problem. What we are doing is we are guiding you. Mentorship, we is same for everyone. And you can go back, you can revise whatever is your source, not a problem. But the
Yes.
thing is that the topics of the PYQs and the
And I think, ma'am,
PYQs
maximum like whatever platform it is, every one of us teach the same.
is the same, and
There's
PYQs
nothing
will
different.
obviously be same everywhere.
Yes.
So it is that thing that your success is our focus. एंड वही वही इसीलिए बोलते हैं कि भाटिया है तो भरोसा है. हम लोगों का फोकस वही है कि अल्टीमेटली द डिस्टेंस बिटवीन यू एंड योर ड्रीम पीजी सीट, दैट शुड बी कवर्ड. So we are always there. Whatever kind of help you require, as Dr. Ramya also said, you can always, we are just a message or a call away. And even the faculties are doing one-to-one sessions. You require any kind of help, academic help, or the strategy help, we are always welcoming you. Any more questions you can ask, guys?
So I think it was a great feast for seeing you, ma'am. And so we have given a gross idea to the students, like, what is the possible way, what they can do. And I think it was awesome for them also to see everything, like what is planned for them from the e-Gurukul.
Yes. So guys, take care, happy learning, and wish you all the very best.
All the best, guys. Start studying, start your preparation back, right? So don't give up, keep on learning. Next 100 days, if you're able to read appropriately, nothing can stop you. Thank you so much, guys. Thank you, ma'am.
Thank you. Yes, always remember that we are unstoppable. So start learning and don't stop before you reach your final destination. And don't, be perturbed by the difficult roads. As I told you, that only the difficult roads can lead to beautiful destinations, and your beautiful destination is waiting for you. Bye-bye.
Bye.